name's Lauren Seymour. I'm a first-year Master's of Public Affairs candidate.
My name is Aileen Ford, and I have a veteran connection in my family. My grandfather was in the military.
My name is Leist. I have personal connections to veterans from my friends, and my grandfather was in the Air Force.
So for me, one of the biggest things was putting a face to the overall veterans population and putting a face to mental illness.
I think veterans' mental health is an issue that a lot of people are aware of, but they don't really understand the intricacies and a lot of the details of it.
I think it would be really helpful if some of the state money could be allocated or kind of funneled more towards the community aspect, so the nonprofits out there. From our research and our interviews with people, it seems that the nonprofits that are helping to fill the gaps that perhaps the VA or the state can't cover are very effective for helping veterans with mental health issues.
My opinion of the veterans courts that we saw both here in Austin and Dallas is that they're a very innovative and interesting way to approach the intersections of different mental health and substance abuse issues that veterans are facing. I liked that a lot of the judges were veterans themselves or had a deep connection with the veterans community. They had that sensibility and that knowledge that you can't always have when you're a civilian.
And so I think these kind of coordinating bodies can help bring in all parts of the community to try and work on this problem and tackle it together.
My biggest takeaway from the project was meeting the professionals and seeing their connections to veterans and how deeply they care. And most of them are veterans, so it was impressive to see them return to continue their service to help their fellow veterans to get all the mental health and physical health services they need.
And I thought that it was a good thing to see the variety of backgrounds of different veterans, to know that veterans come from all walks of life, men, women, socioeconomic levels, and that really we can all be a part of the solution to the challenges that they're facing, and we should.
The most innovative services that I saw were the alternative practices when paired with traditional practices such as therapy or psychiatric care. So pairing that with acupuncture or tai chi or riding horses.
I think the best practices for serving veterans' mental health are the all-encompassing one-stop shops, where they would include mental health services, physical therapy, as well as job placement and preventing homelessness.
I think the best practices were the veteran-run organizations, or at least the organizations where veterans were heavily involved, particularly eQuest with equine therapy, where veterans were hands-on working with other veterans. Also one-stop shops, particularly Heroes Night Out, when you have the peer-to-peer network where people are really coming together in a single place, having a lot of workshops, a lot of informal conversations, just camaraderie really, and having a welcoming environment to bring veterans in.
The best way for community members to get involved is to directly reach out to veterans and educate them on the services that may be available if they are not aware.
Anything that can kind of help bring a veteran out and help them want to seek further help.
My greatest takeaway is definitely the passion that a lot of people bring to this issue, and just how much the state of Texas and a lot of key stakeholders are doing to increase access to services and to improve their quality.
The most profound moment for me was realizing how big of an issue military sexual trauma was, because I had never actually heard about it or thought about it before, and there's large numbers of veterans who have suffered MST during their service.
One final thing that I would like to say, the impact of mental health for veterans is not just something that's individual, which is important. It's also something that's affecting their families and their larger communities and their children and their caregivers and their employers. So it's definitely something that affects us all as Americans.